You think skipping brushing one night is harmless? You go to bed exhausted after a long day, telling yourself, it's just one night, but that one night can quietly start a chain reaction that leads to tooth pain, cavities, and even gum disease. What you don't do tonight can cost you tomorrow. Welcome back to the channel. If you care about your teeth, want to avoid painful dental visits, and protect your smile for years to come, you need to watch this video until the very end. Today, we're going to uncover what actually happens to your teeth when you skip brushing at night, why your gums suffer in silence, and the habits that prevent serious damage. Let's begin with a reality most people overlook. Your mouth is home to billions of bacteria, more than most people realize. These bacteria are not all harmful, but when they have leftover food, sugar, and plaque to feed on, they multiply rapidly. Brushing in the morning removes some of these bacteria, but the real danger comes at night. During sleep, your saliva production decreases significantly. Saliva is your mouth's natural defense. It neutralizes acids, washes away food particles, and slows bacterial growth. Without brushing at night, acids and bacteria remain on your teeth for hours, slowly breaking down the protective enamel. Over time, this leads to cavities, which often start small and invisible but can grow quickly if neglected. Let's talk about the first signs. They are subtle. A slight sensitivity when drinking cold water, mild morning discomfort, or a tiny twinge when chewing. Most people ignore these signals, but they are warning signs from your teeth. The enamel is under attack, and your gums are quietly inflamed. Gum health is also at risk. Plaque that accumulates along the gum line triggers inflammation, redness, and bleeding. This is known as gingivitis, the first stage of gum disease. At this point, it may be easy to ignore, but if left untreated, it can develop into periodontitis, a condition that damages bone, weakens teeth, and can eventually lead to tooth loss. Some people think skipping brushing occasionally won't matter. The truth is, damage accumulates silently. Even one night can start the process that leads to long-term issues. Bacteria don't rest, and neither does their attack on your teeth while you sleep. To understand the danger, we need to look at the science behind tooth decay. When you skip brushing at night, plaque builds up on your teeth. Plaque is a sticky, colorless film of bacteria that clings to every surface of your teeth. While you sleep, this plaque multiplies. It produces acids that attack enamel, the hard outer layer of your teeth that protects them from damage. Enamel may be the hardest substance in the body, but it is not invincible. Acid erosion begins slowly. At first, it may cause mild sensitivity to hot, cold, or sweet foods. Over time, small cavities develop. If untreated, these cavities expand deeper into the dentin, the layer beneath enamel, causing sharper pain and making teeth more vulnerable to infection. Gums are equally affected. Plaque at the gum line irritates soft tissue, causing swelling, redness, and bleeding. This is early-stage gingivitis, and it can progress silently. Without intervention, bacteria continue to multiply, leading to periodontitis. At this stage, gums recede, bone deteriorates, and teeth may loosen or fall out. Many adults underestimate how quickly this progression happens. Skipping brushing for just a few nights can set off a chain reaction that escalates over weeks and months. Another factor is saliva reduction during sleep. Saliva naturally neutralizes acids and removes bacteria. Less saliva means acids linger longer, accelerating enamel erosion. Your teeth are more vulnerable at night than during the day, which is why brushing before bed is so critical. Let's also consider hidden plaque between teeth. The spaces a toothbrush can't reach are prime locations for bacteria to thrive. Flossing is essential because it removes plaque from these areas. Without flossing, bacteria multiply, increasing the risk of cavities and gum disease. Some people believe rinsing with water or chewing gum before bed is enough. Unfortunately, this does not remove plaque or bacteria effectively. Water or gum can reduce some acid temporarily, but it does not replace proper brushing and flossing. Tooth decay and gum disease are cumulative. The effects of skipping brushing don't appear immediately, but the damage silently progresses. One missed night may not cause pain right away, but repeated neglect creates conditions for long-term dental problems. By the time pain appears, enamel has already been damaged and gums may already be inflamed. Here's a common scenario. A patient comes in complaining of mild sensitivity in the morning. They brushed occasionally at night, skipped flossing, and rinsed with water instead. Examination reveals multiple small cavities, plaque accumulation along the gum line, and early gum inflammation. None of these issues appeared overnight. They developed over weeks and months of inconsistent care. Prevention is simple, but it requires consistency. Brushing before bed is the single most effective step to protect your teeth. Use a soft bristled toothbrush with fluoride toothpaste. Brush all surfaces, front, back, chewing surfaces, and along the gum line. Use gentle circular motions to remove plaque without damaging enamel. Brush for at least 2 minutes. Flossing is just as important. Floss removes bacteria and food particles between teeth, areas that brushes can't reach. Without flossing, these hidden spaces become breeding grounds for bacteria, accelerating tooth decay and gum disease. Rinsing with an antiseptic mouthwash adds another layer of protection. Mouthwash kills bacteria, reduces plaque, and keeps gums healthy. It should complement brushing and flossing, not replace them. Diet also affects oral health. Sugary and acidic foods feed bacteria and increase enamel erosion. Reducing sugar intake in the evening, maintaining a balanced diet, and drinking water before bed helps keep teeth healthy. Water also promotes saliva flow, which naturally protects teeth overnight. Consistency is critical. Brushing once in the morning is not enough. Skipping brushing even occasionally allows bacteria to attack teeth while you sleep. Establishing a nightly routine ensures protection against cavities, gum disease, and pain. Here's a simple dentist-recommended routine. Brush thoroughly for 2 minutes with fluoride toothpaste. Floss to remove hidden plaque. Rinse with antiseptic mouthwash. Drink water to maintain saliva flow. Following this routine every night protects enamel, prevents cavities, and keeps gums healthy. It also prevents tooth pain before it starts, saving you from expensive dental treatments and discomfort. Remember, prevention is far easier than treatment. Tooth pain is not just inconvenient, it's a signal that irreversible damage may already be occurring. One night of skipped brushing may seem small, but over time the effects are significant. Your teeth work hard every day. They help you chew, speak, and maintain your appearance. Brushing before bed is not optional, it's essential. Make it a habit tonight, follow the dentist-approved steps, and protect your smile for a lifetime. Don't wait for pain to remind you of your teeth's importance. Brushing at night, flossing, rinsing, and staying hydrated are simple habits that protect you from cavities, gum disease, and tooth pain. Start tonight, make it consistent, and keep your smile healthy for years. If you learned something valuable today, like subscribe and share this video with someone who skips brushing at night. Your future smile will thank you.